Trial tappers reframe life's trials and traumas. I will explain how right after this. Hi, I'm Hugh Watt. Welcome to Trial Tappers. Trial tappers tap pain, find a path, and grow stronger. How powerful is a word? What do you think of when you hear the words mental, illness, disorder, diagnosis, anxiety, post-traumatic stress disorder or PTSD, mood disorders, depression, addiction, sadness, addict, shame, or trauma? Imagine what life could be like if you reframed trials into something positive. We should attempt to use words that are less stigmatizing or that are less negative. In my books in the Trial Tapper series, I introduce you to the concept of reframing trials. What does reframing mean? It's kind of like looking for the positives in a difficult situation. I realize that it may be impossible to find anything positive in the worst traumas. So let's begin to consider looking at something positive in other trials that you have faced. A reframe is the process of looking at a trial as something you can grow from. It might be difficult or even impossible to imagine anything good coming from some trials, such as abuse or cancer. I challenge you to find the growth beyond the trial. Now be aware that this process takes time. It could take years to find anything positive from your trial. Here are two different picture frames. One is old and broken, and the other repaired with flowers painted on it. The photo inside is the same storm. The words we use are powerful. Now consider reframing the meaning you place on the following. Why is the word post used by therapists? For example, PTSD. Some professionals use the word post instead of using the word after. It's like saying, after the trial occurred, you're going to have some stress, anxiety, depression, recurring memories, and grief. If you're given any label or diagnosis, decide to change your internal definition. I want you to reframe any systemic label given to you after a trial. Don't think of it as something wrong with you. What you are experiencing is typical. I help others like you by reframing the symptoms or diagnosis. For example, have you been told that you have an anxiety disorder? This trial can lead to growth from the anxiety. You have a depressive disorder? This can lead to growth from the depression. You have PTSD? Although this is more difficult, it is an opportunity for a new reframe. This can lead to growth after the trauma. Never refer again yourself as having PTSD, but now say, I'm experiencing or have experienced post-traumatic stress and growth, or PTSD. Remember, a person that abused drugs or alcohol is not clean, but they are in recovery. You are not a victim. No, you are a survivor. In a current culture where everyone is sensitive to what people or groups are called, it's amazing that we still use this word disorder. It sounds like there's something wrong with you. I want you to reframe this word, disorder. The goal is not to identify with the symptom or the diagnosis. In other words, I'm not an alcoholic. I'm a person struggling with alcoholism. Let me try to explain it in another way. When your car starts to act differently, you will probably take it to a mechanic. and try to explain what you think is wrong. Now, after listening to your best guess, the mechanic will try to diagnose the problem by listening to the running engine. He'll run some diagnostic tests. And what does this diagnosis mean besides a big bill? Well, something went wrong with one part of the car. The entire car is not broken, just one part that affects the rest of the performance. The mechanic will make adjustments and repairs to some very specific parts, and after a little time, it may even run better than it did before. When you go to the doctor, they will attempt to diagnose your medical condition based on the symptoms you share with the doctor and what they see after running some more tests. Once the problem is properly diagnosed, they can recommend some very specific treatments for that problem. Let me simply explain what could happen when you seek professional help while experiencing a more difficult life trial. When you go to a therapist like myself, we will also try to diagnose your mental health illness or condition. We will listen to your symptoms, ask you specific questions, possibly have you do some written tests, and eventually we will come up with a diagnosis and tell you that we have found this problem and you have some disorder. For example, depression, anxiety. A disorder. Sounds bad, right? What a ridiculous word. Who wants to brag about your friends on social media? Is this going to increase your status on Facebook? Having your condition labeled as a disorder can add to your anxiety, your stress, and your depression. You probably already feel bad about your life trial, and now a professional has confirmed there's something wrong with you because you have a disorder. In simple terms, professionals use the word disorder to explain a pattern of negative reactions that a person is experiencing for a significant amount of time, which causes distress in their life. This usually affects their patterns of behaviors, their thoughts and feelings after a difficult trauma. Everyone will experience symptoms or reactions of anxiety, stress, and dare I say, depression from time to time. Some trials only make you sad temporarily, but others and severe traumas can cause even the strongest people to have reactions that require professional help. If you seek professional help and are given a diagnosis, consider this a positive path to accelerated growth. Many people around you are experiencing similar trials, yet too many resist the help, suffer longer than needed, and fail to grow from the trial. Why do they suffer alone? I think it's because they fear the possibility of this one word, disorder, and how those less informed define it. If you find yourself experiencing more negative reactions than you can deal with, I hope you will be wise and ask for help. I challenge you to reframe the words that we put on things. You can overcome this trial and any trial you face. Now, if you like what you've heard so far, please hit that like button. If you want to see more future videos, hit that subscribe button. If you know someone that's struggling, perhaps share this video with them. Please comment below. How have you reframed one trial to be positive? I'm a trial tapper. I tap pain, I find a path, and I grow stronger. Are you ready to move away from pain and towards a brighter future? See you next time.